Hi, and welcome to the next video in the Maternal Health webinar series presented by Security Health Plan. Self-advocacy during pregnancy, labor, and postpartum is essential because it ensures you receive safe, respectful, and appropriate care. In this video segment, we will help you understand self-advocacy, the importance of a solid care team and support people, and steps to take so you can properly advocate for yourself and your baby. Let's get started. So what is self-advocacy? Self-advocacy is the ability to speak up for yourself and the things that are important to you. Self-advocacy in a healthcare setting can take many forms. It is knowing what you need and want and being able to articulate it clearly, being able to communicate your thoughts and feelings, having full comprehension of your patient rights and responsibilities, being able to make or understand decisions about your care, and speaking up when you feel uncomfortable or unsure. Self-advocacy does not mean you have to do everything alone. One major part is being able to recognize when you need help. Self-advocacy is crucial because it helps ensure you receive the care you need, particularly in a healthcare system that has documented disparities in maternal outcomes, especially for marginalized groups. Since many people do not have access to a support system, doula, or birth advocate, it is important to speak up about your needs and wants. Doing so prevents poor birth outcomes resulting from bias or discrimination. It can reduce your stress and anxiety that surround your pregnancy. It empowers and allows you to further participate in your care, and it ensures concerns will be addressed and validated. Advocating for yourself can significantly impact both maternal and infant health outcomes. It is important to have conversations about maternal health disparities with your care team and trust your intuition. During your first appointments, ask your provider how they work to combat maternal disparities in their practice. Discuss how your social identity, meaning race, national origin, gender identity, or sexual identity, may impact your pregnancy, labor, delivery, and postpartum experience. Even first-time parents can know when something is wrong with their body and pregnancy. If you feel unusual symptoms, pain, or just off, call your doctor, OB triage, or visit an urgent care. Remember, no one knows your body better than you. Speaking up can prevent complications, and even if it turns out to be nothing, at least you have reassurance. If you still feel unsure or are not being heard, do not hesitate to ask for a second opinion. People from different backgrounds have different traditions and preferences when giving birth, so creating a care or birth plan anticipating how your identity may impact your labor experience is a good idea. Clearly state your preferences to reduce confusion. You might include who is allowed in the delivery room with you, what you would like to wear, different labor positions, pain relief preferences, and more. Ask your provider to keep a copy of your care plan in your chart. Also, bring a hard copy to your delivery for reference. You can find many care and birth plan templates online for free. It does not benefit you or your healthcare team to be in the dark. You need to make important decisions fully understanding what you are agreeing to. So make sure you ask about pros and cons of a procedure. Ask open-ended questions that prompt your provider to go into further detail. And ask for reading materials about whatever condition you may have, procedure you may go through, and symptoms you may experience. It may be in your best interest to hire a doula or birth advocate. A doula is a trained professional who provides culturally comprehensive, emotional, spiritual, and physical support during pregnancy, labor, birth, and early postpartum. Similarly, a birth advocate is a person who actively supports a birthing person's choices and preferences during labor and delivery by communicating their wishes to their healthcare provider, asking questions, and providing the patient with evidence-based information. In rural areas, there tends to be a lack of these resources. So if you can find a private doula, they usually charge a flat rate fee for their services, or you can look into community-based doulas and they can usually charge insurance or lower their fees. Security Health Plan does have 2 doulas available to members, and most plans cover the cost of these services. For more information on doulas and birth advocates, ask your primary care provider for a recommendation or call customer service. If you feel nervous about asking questions or speaking up for yourself, bring a friend, family member, or partner with you to appointments. You may miss something, and your support person can help you advocate for your needs. It is also important to have a support person during labor and delivery who can speak on your behalf, as you may not be in the capacity to make emergent decisions or communicate your needs thoroughly. As you progress through your pregnancy, educate yourself with intention. Make sure your resources are coming from reputable sources like journal articles, the World Health Organization, the Center for Disease Control, news stations like PBS, and make sure to avoid social media or blog posts. Be sure to ask for after-visit summaries after each of your appointments. This way you can remember what was discussed and any topics you feel you need to research more. While doctors and nurses are there to help guide you through the process, no one knows your body and needs better than you. Speaking up ensures you receive the best care possible. In our next maternal health video, we'll help you understand your rights as a patient. If you have additional questions, please reach out to your provider or call Security Health Plan at 1-800-472-2363. Thank you.